And good morning, everyone. So we're here today to talk about your benefits that are going to begin July 1st. And before I get started with my presentation introduction, I want to go ahead and turn it over to Juan Salas to address a question that came up prior to the meeting starting.
Good morning, everyone. Thank you for joining us today. And this is the Q&A session that we host with CBR. So we are going to have any questions you have for the health benefit, then it's going to be addressed today. So let us know. If for some reason you are not joining the meeting and you watch this later and you have questions, just send us to us and then we can address the answers. So in regards the question that I think this is a very specific and particular group that they have a benefit of 14%, that you guys, for the employees for ACMF, you are going to use this amount to for the organization internally is going to take care of this for you guys. So the rest of the other organizations, they don't have this benefit, the 14%, so it's not going to be addressed. So for the ACMF employees, then it's going to be a policy internally that is going to be addressed to take care of this money. So the minimum or maximum is going to be $475 that amount is going to be towards the benefit package. So that's going to be the difference. You can, depends on the plan that you pick, is going to be either you pay a little bit more, or you can, if you pick a HSA, you are going to make this savings. So that's the answer for that, D.
Okay, perfect. Thank you so much, Juan. So good morning, everybody. My name is Leticia Reynoso. I'm with Creative Business Resources, now part of Resource Edge and One Digital. I'm here today to go over the benefits that are effective July 1st, which is the medical. The rest of the voluntary options are effective June 1, tomorrow. So you may have already gone into the portal and made elections for those voluntary options. What Juan stated earlier, the company contribution 475 covers 100% of the employee only for 3 of the plans. One of the plans is the more richer plan. There's a little bit of a employee cost share in there. The 2 HSA plans do have an HSA seed money, which is money the company is putting into that account if you enroll as employee only, utilizing the full $475 towards your medical benefit. And I am going to just a few housekeeping items. If you can kindly put yourself on mute, unless you have a question, please feel free to ask any questions during the presentation on any of the benefits that I'm going to go over. If you have questions after the meeting, my contact information will be available at the end of the presentation. You can send me an email and I'll be happy to help in any way I can. You'll also have a contact here at CBR in the Human Resource Department that can help with navigating through the system, adding HSA dollars, things of that nature. So we'll talk through every single step of the way to make it as easy for you as possible, and hopefully everyone can get their enrollment done by the due date. So without further ado, we're going to go ahead and get started on the employee benefits. We have an agenda here of the items we're going to review. The medical, like I said, is new and effective July 1st. Some of the other items are effective June 1st. You may already have, seen these through the portal. You may have received an email from our HR team saying it's time to enroll in these voluntary benefits. We're just going to go over those. And if you have questions to those, I can answer those too. I want to make sure and check in, make sure everyone can still hear me because I am on okay, thank you so much, Anna, and thank you for nodding. So open enrollment for your medical starts today. and it will end on June 11th, which means you have until June 11th to go into the employee portal known as PRISM and complete your medical election or waiver. If you decide you do not want to enroll in the medical, we ask that you kindly go in and waive the medical. It will ask you for a reason. We ask that you answer that, please. If you do nothing, we are going to presume that's a waiver and you will not have the opportunity to enroll medical benefits until next year. Some more housekeeping items here on the screen. So all employees that work 30+ hours are eligible for the benefits. You may also enroll a spouse or a domestic partner, and children up to the age of 26 are covered until the last day of the month in which they turn 26. That's critical if you're going to be enrolling dependents. And as I stated earlier, the medical benefits are going to start July 1st. During that period, and once you make your election, you cannot make any changes to any of your pre-tax deductions unless you experience a qualified life event. You'll see some of those examples listed on the screen. If you have a change in family status, marriage, divorce, birth of a baby, adoption, things of that nature, that's going to change your family status. If you lose coverage or gain coverage through a spouse or any other source, that's going to be a qualified life event as well. And we do ask that you notify us within 30 days of the life event so we can open up the portal for you. You can go in and make your needed changes. There is a special circumstance that gives you 60 days, and that is if your qualified life event is gaining or losing Medicaid, Medicare, coming on or off a federal exchange. Again, that's going to be a 60-day from the date of the event. We're going to go over the medical plans. They are with Blue Cross Blue Shield of Arizona. These are going to be under the statewide and national network, which means you have coverage in all 50 states. It does include the Mayo Clinic and Phoenix Children's Hospital in the network. Mayo campus here and throughout the U.S. So that's all going to be a network. It also going to include Dignity, Barrow Neurological, Banner Hospitals, University Medical Center. So it's a pretty large network. I do invite everyone, once you get your ID card, to register at Blue Cross. It's BCBSAZ, and you'll get that information in your benefit guide. So you can register, and then you'll be able to find providers, download temporary ID cards, take a look at your claims, and all that good stuff. So we'll go over these plans with a little bit of detail. It is high level. I do invite you to look at the summary benefit of coverage that's in the employee portal, and it has all of the coverages, exclusions, and limitations to the plan. So the first plan here is going to be your richest plan. It's a PPO $2,500 individual deductible. Keep in mind your deductible is calendar year. So what does that mean for you? Since you're coming onto the plan July 1st, any part of the deductible that you meet from July 1st to December 31st will not carry forward to 2025. So your deductible will set January 1, 2025, and that is to keep in line with the health savings account and the flexible spending account. The deductible on this plan comes into play with major medical services such as hospitalization, surgeries, whether it's inpatient or outpatient, and in some instances, imaging such as CT scans, PET scans, and MRIs. It really depends on where you have that type of imaging done. If you go to your doctor's office and they have the ability to do it there, you're going to have a copay. If you go into a hospital setting, it's going to be deductible. So just keep that in mind when you're making appointments for your services. Now, if you meet the deductible in the calendar year, you're responsible for 20% of those major medical expenses until you reach that out-of-pocket max. Now, your out-of-pocket max on this plan and all of your options is reduced by the deductible, reduced by the 20% coinsurance, and applicable copays. So it's not in addition to the deductible, but reduced by the deductible. So your out-of-pocket max is your worst case scenario in a calendar year. So if you have a catastrophic event, end up in the hospital for a few days, you have therapies, MRIs, CAT scans, that is the most you can expect to pay for medical services in network. Again, if you meet the out-of-pocket max, you are covered at 100% for the rest of the calendar year for all services, including pharmacy. Preventative care services, so this is age-appropriate, gender-appropriate lab work, screening, and immunization, all covered at 100%. It is particularly important that you go to an in-network lab, so make sure you go into your portal, search for a lab. I know sometimes our doctor's office sends us to whatever lab is closest to their office, or if they don't do it in-house, and that could produce a bill. In the event that you did all of your homework, you went to your doctor, you did your preventative, you went to an in-network laboratory, and you still received a bill either from the lab or the doctor, you want to bring that to our attention as soon as possible so our Blue Cross Blue Shield liaison can review that bill and the codes that were used. So that's sometimes miscoded either by the lab or the doctor's office. So we want to make sure we get that squared away as soon as possible. Office visits, so primary care doctor, whether it's in-person or virtual, or a walk-in clinic inside of grocery stores or pharmacies, $30 copay, specialist $60, and you may self-refer to specialist. So diagnostic testing such as x-rays and blood work is either going to be deductible or an office copay. It really depends on where you have it done. And then urgent care, $75 copay per visit. Emergency room, $250 copay per visit. And that's in or out of network. So in or out of network means that you walked in or were taken to an out of network emergency room. You were treated and discharged, or if you have to stay there. If it's a true emergency due to legislation that passed a few years ago, those doctors, providers, facilities no longer have the ability to balance bill you. Again, only true emergency. If it's not a true emergency, you can expect to receive a bill from those providers. Any questions so far before I go into the pharmacy? What options do we have if we aren't living in Arizona? Great question, Sarah. The good news is these plans are national. Does not matter where you live, you're covered. All 50 states are part of the network. So we're going to go right into the pharmacy. So under pharmacy, you actually have 8 tiers. You only see 4 on the screen because the last 4 are specialty medication. And specialty medication is going to require pre-authorization. There's paperwork that needs to be completed. Your doctor needs to submit that to Blue Cross. It gets approved, and then you're going to have to go through a different type of pharmacy vendor for that specialty drug. So tier 1 is going to be your generic. So the most you will pay for generic drugs is $10. Some pharmacies have $3 and $4 generics. That's what you're going to pay. Tier 2 is name brand preferred up to $35. Tier 3 and 4 are name brand non-preferred. So those are the drugs that are highly advertised on TV with all the different side effects. Those are going to be your non-preferred drugs that are going to have a little bit higher copay. If you're on maintenance medication, I do recommend mail order. It is 2 times retail copay for a 90-day supply. So it's a little bit of savings. You can do 90-day at retail, but it's 2.5 copay. So just a little bit of savings there as well. All right, we're going to jump right into the next PPO plan. Again, these are national plans. So this plan is a $4,000 individual deductible, $8,000 family. Same rule applies here as to when your deductible comes into play with those major medical services. Again, if you meet that deductible, you pay 20% of all major medical until you reach your out-of-pocket max. Preventative care services is covered at 100%. And then you have co-pays for your doctor's office, specialist, urgent care, and emergency room, just the same as the other plan. And the pharmacy is exactly the same as the other plan as well. What's going to be the difference between these 2 plans, if you can see the out-of-pocket mask is exactly the same, is the deductible. And then the PPO 2500 plan is a little bit more expensive per pay period. The PPO 4000 as employee only is going to be covered at 100% by the company. We have a do one question online, follow-up question about being out of state. Is national coverage considered out of network? No. So it is not. Out of network means that the provider, the doctor, the facility, the lab is not contracted with Blue Cross Blue Shield or any of its affiliates, such as Blue Cross Blue Shield, Anthem, Regents. They contract with the different networks throughout the US, and they share information through something called the Blue Card. Those are all in-network providers. If it's an out-of-network provider, there is no contract anywhere with any doctor, any facility, nothing. So they can charge whatever they want. They can see you. They will gladly take what Blue Cross Blue Shield pays them, but they're going to come to you for the difference. So I always recommend staying in network when possible. If there is a situation that you're currently under medical care or you're seeing under treatment and that particular provider or treatment center is not in network, I need to be made aware of that because Blue Cross Blue Shield will pay that provider as in network until you're able to safely be transitioned to an in-network provider. But it's only if something is going on now. And then we're being asked for the cost difference. So your cost difference, when you log into the employee portal, that's where you're going to see it by plan. You're going to see every plan side by side. You're going to say, I'm enrolling as employee only. You're going to see 3 of the 4 options at 0 cost to you. And then one of the options, you're going to have a little bit of a copay, a little bit of deduction from your paycheck. And that's on the PPO 2500. All right, moving to your 2 high deductible HSA qualified plans. So HSA is a health savings account, and I'll go over the details of the HSA in the next few screens. But both of the plans listed here on the screen are deductible first plans. That means that you're going to pay deductible for all services with the exception of preventative care. So again, that age-appropriate lab work, screening, and immunization. Also, any preventative medication and FDA-approved contraceptives are all available before the deductible. So again, before the deductible, the services that are available to you, preventative care, preventative prescriptions, and FDA-approved contraceptives. You want to be able to use your HSA dollars and HSA account to pay for any other out-of-pocket expenses. You'll notice that the out-of-pocket maximum on this PPO 3200 is a little bit lower than the other ones, so it's a lot less out of your pocket. So $3,200 is, and this is as employee only, this is at 0 cost to you, plus you get a little bit of money going into your HSA account. So $3,200 individual deductible, $6,400 family deductible. Preventative care services covered at 100% for all family members. Preventative drugs covered at 100%. FDA-approved contraceptives covered at 100%. All other services are going to be subject to your deductible, and then after the deductible, the 10% coinsurance. It is important to note that once you meet the deductible, that's when the rest of the copays for a pharmacy begin. Prior to deductible, you pay full retail with the exclusion of preventative and FDA-approved contraceptives. So you're going to continue to pay the 10% until you meet the out-of-pocket max. Once you meet that out-of-pocket max, you're covered at 100% for all services for the rest of the calendar year, including pharmacy. If you do not meet the deductible, you're going to pay a deductible. So you still want to show your Blue Cross Blue Shield ID card. So you're going to pay contracted negotiated rates with providers. Let's say your doctor's office charges $90. That's what you're going to pay, and that's going to go towards meeting your deductible and out-of-pocket max. Diagnostic testing, imaging, urgent care, emergency room, all subject to contract negotiated rates until deductible, then 10% up to the out-of-pocket max. And then the next plan is a little bit higher deductible, and this is also HSA qualified. It works exactly the same as the other plan. Again, if you're enrolling as employee only, you get this plan at 0 cost to you plus money into your HSA. Those of you that are enrolling with family members, you get the full $475 applied towards the rest of the tiers, such as children, spouse, or family. So again, on this plan, you're going to have that preventative care covered at 100%. You have the FDA-approved contraceptives and preventative drugs covered at 100%. And then I do have an 8-page list of the preventative prescriptions. So it's a lot of medications that falls under that preventative. And then we have a question: are chronic medical conditions, high blood pressure, MH meds, et cetera, considered preventative? Yes, they are. They are considered preventative. So anything that is a maintenance medication, a preventative medication, they fall under that list and are covered before the deductible. So once you meet the deductible, 20% until you meet the out-of-pocket max, just remember you're going to pay contract and negotiated rate with these providers. These are really good plans if you go in once a year, forget to get that annual exam. Maybe you take 1 or 2 maintenance medications, preventative medications. This is a really good way to save for future medical expenses because you have the opportunity to put in pre-tax dollars into a qualified savings account to use towards medical, dental, vision, anything your doctor can write your prescription for, you can use your HSA dollars. And I'll go over that in more detail. But before I move to the next screen, I want to check in for questions. All right, we're going to go over your telemedicine. So for those of you enrolling in Blue Cross Blue Shield, outside of your regular primary care doctor or your specialist, you have the ability to utilize Blue Care Anywhere. These are also board certified physicians, certified counselors, or psychiatrists that can help you navigate through any issues you're immediately having. If you're traveling for work or on vacation, you can use the medical services. These doctors are able to diagnose and send a prescription to a pharmacy wherever you are in all 50 states. It is not intended for emergency services, and it is not intended for out-of-network services. Counseling and psychiatry is also available, and you may set up a recurring appointments with either of the professionals. There are copays for these services if you have an HSA. If you have any of the 2 plans, the PPO 2500 or the PPO 4000, these services are at 0 cost to you and your family members. The HSA, there is some cost share involved, so you'll have to enter your HSA account to pay for these services. Once you get your medical ID card, there is an additional app that you can download to your telephone, tablet, or computer, and you will go in and answer some questions and set up that payment if you're on the HSA, and then the services are available immediately. So the medical, they probably have a wait time about 5 to 7 minutes. Counseling and psychiatry, probably 10 to 15. And again, you can set up recurring appointments with those professionals. So the cost comparison, yes. If you're speaking to the cost comparison of each of the plans, yes, you're going to see that cost comparison for each plan. The next thing we're going to go over is health advocates. So health advocate is your personal health advocate for you and your family. So they can help you navigate through the red tape of healthcare if you're having problems setting up appointments, do a hard to reach provider, second opinions. If you want it, if you need help going over your explanation of benefits or a bill that you may have received, they can help you navigate through all of that. We're going to go over the HSA or health savings account. So an HSA or health savings account is a bank account that you open and that you own. So we assist with that. So what will happen next is once you go through the portal, for those of you that are going to enroll in the HSA, in our office, you will get somebody from our office will reach out to you and ask you if you want to contribute additional dollars towards the HSA. If that is the case, they're going to help you set up the account. It is a full bank account, which means you own it 100%. It is set up with your information. You do get a debit card mailed to you, and that debit card you can use to pay for medical, dental, vision, prescriptions, over-the-counter medications, anything your doctor can write your prescription for, yoga, Pilates, acupuncture, holistic care, all that can be used, all those dollars can be used for that care. It is important to know if you're signing up for the HSA that once you receive the email from our team, that you immediately respond, set up that HSA account, at least to get the money that the company is going to contribute as employee only. If you don't open the account, don't set it up, there's nowhere for the funds to go to, and we don't retro it. So it has to be set up immediately in order to take advantage of those dollars. Also, why it's important is if you go to the doctor and you have a claim and your account is not yet open, you can't use any of those pre-tax dollars to pay for those claims. It's very important to get that open. You will get something in the mail from UMB Bank. You'll get 2 pieces of mail. You're going to get 1 letter with your PIN number and 1 with the actual card. You have to make sure that you activate it, set that up, because once we start payroll deductions, if you're adding more money or just the company money, we need a place to put it in. So if it's not open, not set up, that money is going to come right back to us. All right, so we'll go over the HSA. So again, the company is contributing if you're enrolling as employee only and you're enrolling in the HSA options. And you can actually add more money of your own pre-tax dollars, so that helps lower your taxable income. A few caveats to the HSA. So who can add money to the HSA and who can take advantage of the company contribution? So you have to enroll in the high deductible health plan. You do have 2 being offered to you. You cannot be enrolled in a flexible spending account or FSA, and you cannot be enrolled in Medicare, and you cannot be claimed as a dependent on somebody else's tax return. So those are the qualifiers for to open and fund an HSA. And also the contribution amounts every single year change. How much of your pre-tax dollars can you put in as an individual? From July to the end of the year, it's 4,150. As a family, it's 8,300. You have to remember to subtract what the company is contributing if you're enrolling as employee only, and then that's the amount that you have left to add to your account. So if you're enrolling as employee only in the HSA account, I'll tell you for the 3,200, it's prorated. So beginning July, the maximum, and that's on an annual basis, is $46.58 per month going into your HSA. If you enroll in the HSA 5,000, it's $100.53 going into your HSA. And again, for those of you that are enrolling in the high deductible HSA qualified plans as employee only. So that's very critical. If you're enrolling with spouse and dependents, that full amount is being applied towards the other tiers. And I have a message saying my account says enrollment period has ended. I cannot see any of the costs associated to me. So thank you for bringing that to my attention, Noel. And this is going to be addressed with our internal team. We're going to move on. Any questions on HSA?
There is a question here for the 14%.
You want to address that one, Juan?
Yes, very quick. So the 14% is already set up in your benefits that ACMF provide to you guys. So it's not new, but you can use that part of this 14% for your medical insurance. I'm not sure if I answered that, but if not, I can follow up after the end.
Thank you, Juan. All right, we're going to move on to the next option, which is your flexible spending account. This is more of a high-level overview, excuse me for going so fast, because the open enrollment for FSA happens in the fall. And we are going to be changing vendors. So in October timeframe, you will get notification for those of you that enrolled in HSA. You will have the opportunity to enroll in what we call limited purpose FSA, which means it does not cover anything medical, only dental and vision and other things of that nature. For those of you who are not enrolled in HSA, you can take advantage of the full FSA for medical. The FSA, as a reminder, is standalone, which means you do not need to enroll in any of the benefits in order to take advantage of the FSA. It is also a pre-tax deduction. Big difference between the HSA and the FSA. The HSA is a bank account you own 100%. There is no use it or lose it on the HSA. The FSA, there is a use it or lose it provision. So we need to make sure that we take that into consideration come the fall if you want to enroll, that there'll be funds that you have to use by the end of the following year. We're going to go over as a reminder on the dental. I think everybody had the opportunity to enroll in the dental and vision, some of the other voluntary plans. I'm going to go over these high level. You'll have these available in your benefit guide that should have gone out to everyone. If you did not get the benefit guide, please let me know. We'll make sure that you get that. So the two plans are with MetLife. You'll have two options, one with the $1,500 annual maximum per person enrolled. And the second one is a $3,000 annual maximum per person enrolled. Both plans cover your preventative care services at 100%, which includes 2 cleanings per year, x-rays, space maintainers and sealants, fluoride treatments for children. Basic restorative covered at 80%, which is like cavities, and you pay 20% of charges. Major services, that's going to include crowns, bridges, root canals. Those are going to be covered at 50%. And then if you utilize the basic or major services, you do have a one-time deductible of $50 as an individual or $150 as a family. If you're already contributing or enrolled in these, then that stays the same. And we'll go over for those new hires here in a sec. If you're a new hire onboarding, you're just going through your waiting period, you will have the opportunity to enroll in all of the benefits. Okay, moving on with the dental. So the silver plan gives you an additional $1,000 to use towards child ortho, and the gold $1,500, and that is for child or adult ortho, and that is a one-time lifetime benefit per person. This is the monthly cost for the dental. This is the gold on the top, silver on the bottom. Again, if you already went through this open enrollment, you already made those elections, no changes needed. If you're new, going through the new hire process or just coming out of your waiting period, you will have the opportunity to enroll in these benefits as well. We're going to go over the vision. Again, these are effective tomorrow, June 1st, and both of these are with the VSP network. So a couple differences between the silver and the gold. Again, you may have already enrolled and no action is required for the vision plan. So they both give you an annual eye exam with a $10 copay. The silver plan gives you $150 allowance every 24 months for your frames. The gold is $200 allowance every 12 months. So both of these plans do offer wholesale allowance as well, such as Costco, Walmart, or Sam's Club. The materials copay is $25. The contact lens allowance for silver is $150. Contact lens allowance for the gold is $200. Both of these plans offer additional diabetic care. And then the gold plan gives you an additional pair of glasses. So you can get 2 glasses from July 1st to June 1st to May 31st of 2025. Again, this open enrollment happened earlier. If you're a new hire or coming out of your waiting period, you have the opportunity to enroll. And then this is the monthly cost for the gold vision plan and the silver vision plan at the bottom. We're going to go over some of the life and disability options. These are all going to be 100% voluntary. And we're going to focus on the life insurance here first. The life insurance, for those of you that are already enrolled, nothing to do. Everything stays the same. Just a reminder to update your beneficiary if you need to update throughout the calendar year. If you live in the state of Arizona and you're legally married, your spouse, it should be your first beneficiary. After that, you may name whoever you want. He or she may also opt out of being beneficiary, but that requires an affidavit. Okay, so voluntary life insurance is available to all employees working 30+ hours. You may enroll in 5 times annual earnings up to $750,000. The guarantee issue is for new hires and newly eligible employees. So if you waived it in the past, there's a note here saying you will have to complete an evidence of insurability. So again, new hires, newly eligible employees, 5 times base annual up to $250,000. That is your guarantee issue, which means no medical underwriting is required. Employee and then spouse is 50,000 guarantee issue, and children is 10,000. And then there is no benefit reduction on this plan. So typically, life insurance policies reduce the face value based on our age. And again, if you previously waived this coverage and now you would like to enroll, we do require an evidence of insurability to be completed. It will be submitted to MetLife for review. Depending on the amount, it may be a simple yes, or it may require additional steps to be approved. We're going to go over the voluntary short-term and long-term disability. So those of you that are already enrolled in this program, nothing else to do. For those of you that are newly eligible or new hires, you can enroll without an evidence of insurability, but the pre-existing condition limitation still applies. For those of you not living in the state of Arizona, just make sure if you live in a state that already has a state mandated short-term disability plan, that you review that carefully. Typically, voluntary short-term disability carriers such as MetLife will offset for any amount received by the state. So the short-term disability starts to pay on the 14th day of accident or illness. It replaces up to 60% of your pre-disability earnings, which includes base, bonus, and commission. Maximum payout per week is 1,000. Maximum duration is 11 weeks. The pre-existing condition applies even for those of you that are new hires and newly eligible. That means if 3 months prior to the effective date you saw a provider, took medication, or were diagnosed with a condition in which you submit a claim for, it will be excluded from compensation for up to 12 months. Again, for those of you that are already enrolled and have been since last year, you've more than met this pre-ex requirement. We're going to go over the long-term disability option. Again, this is 100% voluntary. Again, if you previously waived this coverage and now would like to enroll, an evidence of insurability is required. And then for new hires, newly eligible, you do not need to complete an evidence of insurability, but the pre-existing condition limitation will apply. So it starts to pay on the 90th day. 60% of your pre-disability earnings, again, includes base, bonus, and commission up to $7,500. And maximum duration is age 65 or normal Social Security retirement age. And then the pre-existing condition limitation does apply. Again, 3 months prior to the effective date, you saw a provider, took medication, or were diagnosed with a condition in which you submitted a claim for, it will be excluded from compensation for up to 12 months. All right, any questions before we jump into the additional voluntary coverages? All right, we're going to jump into the identity theft and fraud protection. So we were previously offering this coverage through a different vendor. This is new. If you previously had that coverage, we automatically moved you to this coverage. If you want to enroll in this coverage, please let us know. We'll assist with that. This is a post-tax deduction benefit, which means you can't come on during this period. So there's 2 different types of plans, or 2 levels of coverage, I should say. The protection plan is basic protection for identity, finances for up to 2 devices per adult. The Protection Plus plan is a little bit more robust with unlimited devices covered in the family. You'll see the per month deductions are at the bottom. Your benefit guide will have additional information as to what is covered. It's a whole page of information. We'll make sure to send that out to everyone as soon as we're done with this presentation. We're going to go over the legal plan. So we offered a legal plan with a different vendor. This one starts tomorrow. This is with MetLife, and it's a very robust legal plan. It covers you and your entire family for one premium, which is $16.50. It has a lot of different coverages that will save you a lot of money. There are no co-pays involved with the plan. It is a time with an attorney, a professional. There could be some exchange of dollars or additional costs, such as filing warranty deeds or grant deeds or family trust documents to the county. That's where you can probably expect to pay some out-of-pocket expenses. So really good and easy to use, robust plan. We're going to go over some of the options that replace AFLAC. So for those of you that were enrolled in AFLAC, you were automatically moved to one of these plans depending on what you were enrolled in. So the critical illness, accident, or hospital indemnity plan. So there's a question in the chat. So if we want to waive medical because we have coverage elsewhere, are we still eligible for the 14% if we still elect to pay for dental or vision? I'll defer to the TAPAZ team on that. Critical illness covers you upon diagnosis. So you can enroll yourself, spouse, and children. If you're diagnosed with one of the major illnesses or cancer, you can either select a $15,000 or $30,000 lump sum payout. You may enroll your spouse for the same amount that you enroll in, and children under the age of 26 are covered at zero cost for half of your benefit. The accident plan covers things as small as paper cuts, and then more serious things, broken bones, contusions, lesions. If you're a weekend warrior, have kids in organized sports, or just clumsy like me, this is a really good plan to have because every time I go to the doctor for something that I did, I get money back into my pocket. This does require medical substantiation, which means you went to the doctor for whatever accident you had. You submit that claim to MetLife, and they're going to pay you direct. So all three of these plans are indemnity plans, which means they indemnify you. They do not pay providers, doctors, facilities. They pay you directly. And then finally, the hospital indemnity plan requires a 23-hour stay in hospital. So if you have an upcoming procedure, family planning, this is a good plan because it's going to put money back into your pocket. We're going to go over some additional voluntary plans. So this is more of not an enrollment plan, but everyone has this available regardless if they enroll in any of the benefits or not. You can waive all the benefits and still take advantage of the Employee Assistance Program, or EAP. So this provides you 5 face-to-face visits per issue per year per family member. An issue can be something different, like, hey, a teenager struggling with peer pressure, struggling with social media bullying, or a parent struggling with road rage or coworker issues. Each of those are going to be separate incidents, and you're going to have 5 phone calls or conferences to address those. Now, the providers or counselors may ask you for medical information, and the reason they do that is so they can find a provider that is contracted with the medical insurance that you have so you can continue your services as needed. Again, this is at zero cost to you and your family. We're going to go over the pet care, so pet benefit solution. So those of you that have your pet already enrolled in this program, no changes at all. The costs remain the same as well. If you would like to enroll your furry pets or cats or pocket pets, it's a good opportunity to do so. So the Pet Plus is discounts at designated websites for food, treats, medications. You can also fill pet prescriptions at Caremark, which is at Target. Whisker Docs is your aftercare for your pet, so like a virtual care, if you will. And then Pet Assure is a 25% savings on all in-person veterinarian costs at participating veterinarians throughout the U.S. And then Pet Tags, the QR code that your pet wears, that'll have your contact information so you can be reached in the event that your pet is lost and found by somebody else. So again, the costs did not change. That all stays the same. All right, we're going to finalize by going over next steps. So we ask that everybody log into the portal by June 11th for July 1st effective date for the medical. Marissa is going to be your point of contact here at CBR, or you can email me and I can help with any questions that you may have. I do some questions coming in through the chat. So with that said, I'm going to go ahead and open up the floor for Q&A.
Right. For the ACMF employees, you are not going to lose your 14%.
Thank you, Juan.
Yes. Are there any questions about that?
Juan, could you just say that one more time so I'd make sure that was clear and people understand? Because I know there's a lot of questions about that.
About the 14%, the 14% it's a benefit that you have. So you are not going to lose the 14% if you waive that, right? If you waive the medical, if you don't want to enroll with CVR, then you are going to keep that.
So just so we're
Okay.
clear, if an employee is waiving their medical plan, they can still have that 14%.
Yes, but this is only applied for ACMF employees.
Got it. Okay.
So there's this benefit is not for all the groups.
And again, Juan, just to be clear, because we have people who have transitioned out of the military, and you know that is a different beast in itself, and health insurance has its own language. So if they opt out of the medical coverage that is being offered right now, are they able to go out into the marketplace, or do they have to take insurance with our company? That's what we want to just clarify too.
Yeah,
that's a compliance issue. So if somebody's being offered qualified medical coverage and they waive the coverage, they may go to the marketplace. The question is, will they be able to apply for a subsidy and take advantage of the subsidy? So the plans that TAPAZ is offering meet all of the criteria under the Affordable Care Act to where an individual would not qualify for a subsidy. So it's 60% actuarial value, it is deemed affordable, and it has minimum essential coverage. So those are the three questions that the marketplace is going to ask, along with, does your employer offer you insurance? And the question is yes. Opting out, does it meet this criteria? It does. You can still enroll in the marketplace. The open enrollment for marketplace is in October, so they would have to have a qualified life event there as well. So it'll be a catch-22 for those individuals that are opting out of this and going to the marketplace. If they're already enrolled in the marketplace, they can stay there.
yes.
Every year there's going to be.
I think that's what we needed clarity on. Thank you.
Yeah, that's why they are going to do the waiver, right? If
we have to collect waivers because the government will send TAPAZ a letter saying your employee X has applied and it's our understanding you do not do X, Y, or Z, and here's your portion of the fine. Then we have waivers that we can send to the government saying, nope, it is offered and they opted out.
Okay, so just to be clear on that, if they opt out because they are currently in the marketplace, they then, when would they, because you said it's October for the marketplace, would be renewal. So again, how does that timeline work for our team? Again, this is a unique change.
It is, so
mid-year.
Okay, Letty, can you
yes.
Yeah,
so for every individual can enroll in the marketplace if they have a qualified life event throughout the calendar year. So somebody losing coverage somewhere with the family, if they were on a different plan, whatever the circumstance was, that is a qualified life event for that individual. They can go onto the marketplace at that time. Their renewal will come up based on when they enroll. The open enrollment for the marketplace, which means anyone can jump in without a qualified event, is October. Each individual person will receive their own, here's your June 1 effective date with the marketplace. Come June 1, 2025, you're renewing. These are the qualifiers, and they have to substantiate income as well. The marketplace is tied to the IRS, so they automatically know what everybody makes. They qualify for a subsidy. If they do not qualify for a subsidy, if it's less expensive to the marketplace for a family than it is to a group plan. So the open enrollment for marketplace, just to clarify, is when anybody can join and qualified event is not needed.
Thank you so much. And again, if anyone has questions, we have team members that are, currently in the marketplace with their health insurance. They can follow up with Marissa or send you an email. So again, thank you for that clarity. For those who aren't watching our video today or watching it later, not live.
Got it. So unless you're paying already for a Great Marketplace plan, this plan is much better as far as our personal upfront cost goes. That's my experience. So thank you for that, Leslie. Yeah, reach out to us. What you see on the screen is the benefit guide, and I just want to make sure that everyone's received it. If you've not, we'll make sure to send it out to everyone, because the benefit guide is going to have a lot of the information that you're going to need for the carriers to get ID cards, to navigate through the portals. It's going to have all that information for you in this handy dandy benefit guide. And just some quick notes and caveats, right? The medical July 1st, all of the benefits are June 1st. It tells you qualified events. It walks you through that as well. And you reach out to us, breaks down the medical a little bit more, has the HSA information. So really handy dandy to have this. If you have an intranet, you can place this in the intranet. Everyone will have access to it. Network information, and these are live links, which means you just hover over this, takes you straight to their portal. And that is the case with everything that's going to be on here, the dental, which is here on the bottom, vision, et cetera. So this is really good to have if you have, like I said, it's somewhere you can, a shared space for everyone so they have access to these benefits. So any other questions, comments, concerns? So yeah, it's my understanding that the guide was sent earlier.
Sure to put that in our training. Well, then we'll make.
Okay. Juan, do you have a copy of this?
I'm not sure, but if you can send
We'll
me.
resend. Yep, absolutely. So a few takeaways for me, I'll make sure the portal is up and ready for everyone to go in and enroll. I'll make sure that Marissa has sent out the invitation to each employee. So each person will get an email to their personal email, not your work email, but personal email. Or Juan, I think that you all sent an email as well. So Marissa will send an email to personal emails that we have on file, whatever one we have. It'll have the benefit guide, it'll have a link to enroll, and it'll have the YouTube link of the presentation. So once I'm able to convert this presentation, I'll also send that along as well. Thank you for clarifying that as well.
This is Noelle Diller, and I just had a real quick question. I live in Ohio, and I'm just not sure with the legalities of insurance of how this works. So I currently have insurance through my husband with my daughter as well. Because my job is now offering insurance, do I have to take it through my work, or can I continue as we have if I should not want to take it through work?
You could waive through work.
Okay. I just wanted to make sure that I'm not in some sort of like have to situation.
Okay.
The question, Leslie, yes, all the communication is through D right now. So we didn't send the communications to the ACMF employees. So all the communication was managed by D. So D, do you want to still doing the same thing, or do you want us to send individual emails?
As far as the logins, that will still be ideal to send the individual logins, or are you talking about the benefit guide?
Okay, so benefit guide and the, I mean, going forward, we are going to send it individual emails, communications.
Correct. For those who need to log in and do different, and then again, anyone with individual questions. Leslie, just to be clear, we sent out the initial information. It all just came out very quickly in the last week and a half. But any specifics that you need will be answered through CBR, which is now One Digital Resource Edge. So they've had a name change. We still call them CBR. So just to
I'm okay with that too. I'm okay with CBR.
As you can see, there's a lot of changes happening at once. So I want to make sure our team is clear and feeling comfortable.
Yeah, 100%. Yeah. So I'm going to put back on the screen the contact information for Marissa and myself. You can send us an email if you have questions in regards to any of the coverages, providers, specialty medication, if you need additional resources, you need, what's covered under preventative, I can send you all that. Just send me a quick email, and I typically respond within a couple of hours, and you'll have that in your inbox. So, or you can call me and I could put my phone number in the chat. If you want to have a one-on-one, we can do that as well. Okay, we have another question. I will be unlocking my, yes. So Noel, yes. So our HR team is working on that now. Do not always get forward. That's why I asked, just to make sure the benefit guide was already sent earlier this week. Okay. We'll make sure everybody gets the benefit guide. And yeah, so depending on your firewall, it really may stop and you go to junk, spam. It's a PDF document. It's multiple pages. So it really depends on your
So
firewall, your
what I'm
inbox.
gonna do, Leticia, is do you have the version, the PDF version with reduced size? Because sometimes
Well,
it's like you said, it's maybe because the
it's
file.
4,118 kilobytes, so it should be okay.
Yes.
Okay, so I'll send the PDF version. Okay, so we'll make sure to get it out. Apologize, it's supposed to be out already. So now your benefit guide is going to have all your benefit information. It's also going to have guidance in regards to compliance, federal compliance, state compliance. All those documents are in there as well. Marketplace notices, chip notices, those are all going to be available as well.
Leticia, when can we have this benefit guide?
I'll send it to you right after we get done with the call. I'll
Okay,
send it to
so
you, Juan.
today we are going to try to send all the information to you guys.
Yes.
If for some reason you don't receive it, just let us know. Sometimes because it's gonna be, we are going to send it to your personal emails. And if for some reason we don't have the correct email address, that might be an issue. So if you don't receive this information by Monday, let us know, and then we can revise the email.
Thank you, Juan. All right, any other questions? Okay, wonderful.
The open enrollment starts today and is gonna be closed on June 11th.
Correct. So let me just get back to that front page. Sorry for my quick scrolling here. Yeah, June 11th. So, and the medical benefits will start July 1st. All other benefits start June 1st. So the medical and the rest of the benefits will eventually line up in June of 25. So Leslie, they come from, yeah, our email address has changed. So as you saw from the contact list, it's leticia.reynosa@onedigital.com or marissa.barraza@onedigital.com. They come from, the emails will come from Marissa as she sends out the invite to go to Prism, the employee portal, and make your elections.
And at some point, you might receive an email from Jason Barrow, our controller. So that can be also a possibility.
Any other questions? All right, thank you everyone for your time. Great questions, great dialogue. Anything comes up outside of this platform, please reach out to us. We'll be happy to help.
Thank you.
Thank you everyone. Have a great day and have a good weekend.
You too. Bye-bye.
Bye.